Yeah, hi team, welcome back. Yeah, in the part one session, we discuss whatever in alphabetic index and tabular list and how to follow the conventions provided by the guidelines and with precedence over the other guidelines. Okay, classroom take precedence over the guidelines. Okay, the conventions instructions of the classification takes precedence over guidelines. Okay, you have to check alphabetical index first and go to tabular list. You have to code the most specific code. Okay, if you try to enter the not specific one, it will give an error, throw an error. Coronary artery disease, CAD. Okay, CAD, coronary artery disease, other specified, native by. If the patient has native vessels, what means all natural ones. If they have bypass before, it will go to bypass graft. Okay, it is a transplanted heart. It is transplanted. When the patient has any transplanted, if the disease is in the transplanted vessel, we have to take this. Other unspecified, we have to take unspecified. It is not documented. If it is not documented, we have to take this. Angina pectoris is mentioned, we have to take angina pectoris. Ischemic chest pain is mentioned, you know. In our case, the doctor like documented atherosclerosis of the heart disease of native artery without angina pectoris. By default, is going to native artery. Okay, without selecting anything. Okay. Conventional ICD-10 general rules for use of classification independent of guidelines. Okay. The the conventions are independent of any guidelines, specific guidelines, independent of guidelines. The conventions are incorporated within the alphabetical index and tabular list of the ICD instructional notes. The alphabetical index and tabular list. The ICD-10-CM is divided into the alphabetical index and alphabetical list of terms and their corresponding codes. And the tabular list, a structured list of codes divided into chapters based on the body system or conditions. Alphabetical index is in reference to the diagnosis. Okay, diagnosis for alphabetical in alphabetical order. If you have to one condition and the specificity, we have to go by alphabetical index and more specific one based on the diagnosis they provided. If any specific term is there, we have to check that specific term in the alphabetical index and by routing that code in the tabular list only. We have to go directly to that code using tabular list. Okay. Into chapters based on body system and condition. The alphabet list consists of the following parts: the index of the diseases and injury, the index of external causes of injury, and table neoplasm and the table of drugs. The alphabetical index divided into three parts. What are the parts? Diseases of the injury, diseases and injuries, and index of external cause of injury, and the table of neoplasms and drugs and chemicals. Okay, it is mainly four parts. General index for diseases and injuries, and external cause of injuries. When the patient is coming for any injury, we have to document where, why, and when. Okay, how we have to what happened, where it is happened, and the patient is doing at the time of the injury. For suppose the patient is got a fracture when playing tennis. For suppose the patient has an ankle injury, okay, dislocation while playing injury due to injury. You have to code ankle fracture, the reason for the fracture, why it is happened. It is happened due to injury at the time of playing table tennis. Where it is happened in a sports area. We have to code why happened, why it is happened, where it is happened, and the circumstances do for the injury. We will discuss more in the external cause of injury. Table of neoplasm and table of duct availability. If the patient has any neoplasm cancer thing, we will have to check the neoplasm table directly. Alphabetical index for the neoplasms and neoplasms. if the patient has any cancer diagnosis and you are checking in tabular index, it will lead to index in the neoplasms. So please go check, please check in. Yeah, for suppose code neoplasm. Okay, neoplasm. You have to go to cancer of the thyroid. Okay. Yeah, thyroid gland. Primary malignancy, secondary malignancy, carcinoma in situ, benign, uncertain behavior, unspecified behavior. The cancer has in these kind of behaviors. It is a thyroid, cancer of the thyroid, malignant primary, it is a primary. Okay, the origin of the cancer. The cancer may progress to other organs. Okay, if it is from some from other organ and came to the thyroid, it will go to C7989. If it is a carcinoma in situ, they documented thyroid carcinoma in situ, have to take this. Benign neoplasm of the thyroid, if they documented benign neoplasm of the thyroid cartilage, it will go to D14.1. Yeah, sometimes the doctor malignancy type. Okay, sometimes they will tell that it may be benign or can malignant. Okay, they will be on some behaviors, uncertain behaviors. There may be some benign neoplasm or malignant neoplasm. The doctor is not confirming yet that it is a neoplasm or benign. Uncertain behavior, we have to go to this neoplasm of thyroid of uncertain behavior. If the documented unspecified behavior, it will go to D49.7. Okay, you have to check this and that. External causes. Okay, the patient falling, building, burning, down, embarkment, escalator, hill. The patient, suppose the patient got injured his ankle while falling down hill. Okay, you have to take this. Falling from out of hill, falling down hill scale lift. 1781. Okay. 1781 falling from the embarkment hill, we have to code this. It is showing plus sign. There is further specificity. You have to go for further specificity. 81XA fall down embarkment hill initial encounter, fall down embarkment initial subsequent encounter, fall down embarkment hill sequelae. What is initial encounter? The patient is coming for the fracture of the ankle due to falling down hill. It is an initial encounter for present treatment. For initial treatment. If the doctor reduces the fracture and sent home, and the patient, suppose the patient is coming for the second visit with routine healing, okay, without any complications or malposition or malunion, non-union, like kind of things. The patient is coming for the second follow-up visit after the fracture reduction to check the status of the fracture. We have to code subsequent encounter. If the patient is coming for the after 4 or 5 months with some problem related to fracture. Okay, if the documented that the sequelae means it is a sequelae may happen anywhere after the cure of the disease or some fracture, any kind of thing. Sequelae don't have any time limit. If some patient has a fall, he treated with fall, they have a fracture after that they reduced the fracture, and after healing after 6 months, after 1 year or something, 2 years, the patient developed osteoarthritis, post-traumatic arthritis due to the injury at the time of the fracture. Okay, the doctor documented the patient is coming with pain due to post-traumatic arthritis in the ankle due to previous fall and fracture of the ankle. Okay, if they are telling that it is a sequelae. The sequelae may happen, we know, after the healing process has end. Whenever they developed the sequelae, you have to code this for code only, W1781XS. Okay, we have to check the classification are developed from the 7 digits. Okay, first 3 digits are related to chapter. After that, based on the specificity, we have to take the digits, fourth digit, fifth digit, sixth digit, seventh digit. Some, if there is an X, they it is a placeholder. The classification may develop some other codes play in place of X or to further expansion only. Okay, it will be left as a X for further specification in future developments. Okay, we have to code a full for the fullest. If you give VW 17.8, it will be a wrong code. If you code W1781, it will be wrong code. If there is any further digits you have to explain, that we have to take the fullest code. We have to take this. It is a good code only. Otherwise, it is wrong code. Okay, it will not accept, the stream will not accept that code. For after coding, for coding reason for the injury, you have to code where it is happened, why it is happened. Due to playing tennis, it happened. Activity we have to code, and place of occurrence. Code, it will be place of occurrence by code. Okay, we will discuss that in future classes. Okay, presently we are discussing what are the conventions used by the ICD-10-CM for coding diseases. Divided into alphabetical list of terms and other corresponding code and tabular list is structured. Index, external causes, table of neoplasm, and drugs and chemicals. If the patient has some poisoning due to taking some drug, okay, we have to go to that drugs. There are some guidelines pertaining to the adverse effects of poisoning. Okay, whenever we are coding poisoning cases and adverse effect, there are some guidelines regarding coding the neoplasms, table of drugs and poisoning, and adverse effects and underdosing toxic effects. Okay, we have to thoroughly follow these guidelines, adverse effects, poisoning, and underdosing codes. There may be slight difference in the neoplasm coding also. Okay, we have to make sure that we are following the neoplasm guidelines and adverse effects and poisoning guidelines for the diseases. Okay, format and structure. Make a note of it. Adverse effects are different coding, neoplasm has different coding guidelines, and external cause of their different coding guidelines. Okay, we have to make sure that whenever there was an external cause of injury, we have to code based on some guidelines. Table of neoplasms, we have to code based on primary, secondary, uncertain behavior, unspecified behavior, carcinoma in situ. We have the guidelines specific to. Also, there are some guidelines regarding the effects of neoplasm. Sometimes the patient may have pain related to neoplasm. There are guidelines on it. Okay. Sometimes the patient may have neoplasm, the anemia due to neoplasm. Okay. There are some specific guidelines. We have to make sure that everything was followed according to the conventions. Okay. And drugs. In case of poisoning and adverse effects, due to some poisoning or adverse effects of the drugs, we have to follow some guidelines. Okay. Format and structures. Format and structures. ICD-10 tabular list contains categories, subcategories, and codes. Characters for categories, subcategories, and codes may be either a letter or a number. All categories are 3 characters. The first 3 digits. All 3 character category has no further subdivision is equivalent to a code. Subcategories are either 4 to 5 characters. Codes may be 3, 4, 5, 6, 7 characters. This is each level of subdivision after a category is subcategory. The final level of subdivision is a code. Codes that have applicable 7 characters are still preferable to refer to as codes, not subcategories. A code that has an applicable 7th character is considered invalid without 7th character. The code that has an applicable 7th character, if we has a code with 7th character, if we do not code, it is not a valid code. Okay, in previous example, I showed that if you are coding W178, it is a wrong code. W1789, it is a wrong code. If you code W1789X, it is a wrong code. We have to fullest subcategory. Okay, W1789XA, it is a variable code. If you code I25 wrong code, I2510 is the correct code. Okay, for the have to check whether we are coding to the up to the seventh character if available. Okay, there may be no eighth character in ICD-10 as of now. Okay, if they developed ICD-10, ICD-11 CM, if you may have. Okay, we have to code the fullest three characters dot four characters after that. Okay, of total seventh characters. If it is available seventh character, without it, it is not a valid code. If there is no seventh character valid seventh character, okay, in the available in the subcategories, we have to it is the right code. If it is available, we have to code. If it is not available, it is a valid code. The classification does, will show it is available. Right. We show valid and invalid codes. Okay, codes for reporting purpose. For the reporting purpose only, codes are permissible, not categories or categories. Any applicable seventh category is required. Placeholder character. The ICD-10 releases the placeholder X. The X is used as a placeholder at a certain cost to allow for further future expansion. In this code, na W17 XXA, we have further expansion. F17 on W17 89 X is a placeholder here. If they want to further specify the file, they will place the 129 A D or something. The characters based on that their expansion rules, they will place some character in this, and they will expand the further expansion of the file regarding file. Okay, placeholder. The X is used as a placeholder at a certain cost to allow for further future expansion. An example of this here, the poisoning adverse action and categories T36 to T50. Where a placeholder exists, the exist must be used in order for the code to be considered a valid code. If their X character is there, we have to code. We have to take the code for fullest of the seventh character if available. Until we don't to get any placeholder, we we have to check the tabular list thoroughly for every code. We are reporting in that code to report a valid code. If we without if the patient if the code has a seventh character and we are not coding na, whenever if you report a W to I2510 an error, Z79 is an error, I50.0 I5003 is an error, yeah. And 18 only it is an error. It is available with the fourth character. Okay. E1122. If you report E112.2 is an error. Okay. We have to code fullest of the characters available for that. This is okay. Abbreviations, alphabetical index abbreviations. There are in alphabetical index. There may be some NEC and NOS. It is NEC means not elsewhere classified. Other code only. Okay, it is code as other code, other specific code. It is unspecified code. This abbreviation is the alphabet represent the other specified. Other specified means the doctor specified, but we don't have a code in the alphabetical index. That's the code or two other specified code in the abbreviation in the alphabetical index represents code other. When a specific code is not available for a condition, if the doctor specified, but that code is there is no code for that condition they specified by the provider. The doctor has provided the specificity, but we don't have a code in that alphabetical index or coding book. We have to code other specified. If the doctor specified, but if the doctor not specified, but we have a specific code. If the doctor for just documented pneumonia, we don't have an option to select logo or apical or something. Okay, we just code unspecified code J18.9 in this case. Okay, the doctor specified code, not pneumonia. Low PN. Pneumonia unspecified. We have to the data didn't provide any specificity. With influenza, lung, completed pregnancy, congenital, neonatal pneumonitis, aspiration, bacterial, hospital acquired in chickenpox, measles, rubella, lobar, post-procedural, viral, spell, other specified, unspecified. We have to just take the unspecified code. Okay. In that way, we have to take NEC and NOS, tabular list abbreviations, not elsewhere classified. Not elsewhere, the abbreviation in the tabular list represents other specified when a specific code is not available for a condition. If the doctor provided any specificity, but it is not available in the tabular list, we have to code an EC code. If the doctor not provided any specificity, we have to code an OS code alphabetically. Punctuation and brackets. Punctuation. Brackets are used in the tabular list to enclose synonyms, alternative wording to explanatory pages. Brackets are used in the alphabetical index to identify manifestation codes. Mm, alphabetical index has a different meaning for brackets, and tabular list has a different meaning. In the brackets in tabular list enclose synonyms. What is synonyms? Same meaning. Okay. Alternative wording to or explanatory phrases. Brackets used in the alphabetical index to identify the manifestation code. Some codes have a cause and effect relationship. Okay. What is identified? Okay. If the patient has a CKD and the patient has CKD, diabetes, and hypertension. There is a default relationship between the diabetes, CK, chronic kidney diseases, and heart failure, and hypertension and diabetes. It is a per convention we have to take the relationship between the cause and effect and relationship between the three codes, four codes, whatever I mentioned in the diabetes, CKD, heart failure, hypertension, they are related conditions. Okay, whenever the doctor documented those codes, we have to take the relationship. If the if the doctor provided no relation between these codes, we have to take the default relationship. If the doctor documented CKD due to DM, we have to take the relationship between DM and CKD, and we have to code hypertension if documented as a normal one. If the doctor didn't documented any relation between CKD, diabetes and hypertension, we have to take the relationship with the CKD and ICD-10 uh, hypertension and diabetes by default. If the doctor documented diabetes, CKD due to DM, you have to code DM with CKD. If the doctor documented CKD due to hypertension, we have to link the CKD and hypertension alone, not diabetes here. We have to code default diabetes. Okay, unspecified code diabetes. Whenever the doctor dictated explicit relationship between some codes, diabetes and CKD, we have to take that relationship and ignore the other relationships. If the doctor did not dictated any documented any relationship between the CKD and diabetes and hypertension, you have to take the default and default as related only. Okay, if they explicitly documented diabetes is causing some CKD, you have to code CKD with diabetes and code normally the hypertension. Okay, I10 without any relationship with the CKD. It is very crucial. Please make a note of it. I will discuss further relation between the CKD, diabetes, and hypertension and CHF in a for going forward classes. It is a main meaning of the alphabet is to identify manifestation, cause and effect relationships and manifestation codes. It will represent in brackets. Okay, in tabular list and alphabetical index. Parentheses are used in both alphabetical list to include supplementary wording that may represent or absent in the statement of a disease or procedure without affecting the code number to which it is assigned. Okay, when you see any parenthesis, okay, in after the description or something, code description or something definition, it is a supplementary wording only. It will not change based on the those words. Code assignment will not change. It is assigned. The terms within the parentheses are referred to as non-essential modifiers. It is very important guideline. If the if they talk about, if you see some wording in the parenthesis and if they The code selection will not be decided on the wording present in the parenthesis. Okay, we have to look for the what they documented in the out of the parenthesis only. Okay, if you let me show one thing. Yeah. Okay. Here pneumonia is acute, double, respiratory, purulent, septic, unresolved. Those are non-essential modifiers. If the doctor recommended acute, it is not fair. It will not change any code selection. Okay, if they recommended double pneumonia, if they recommended migrated pneumonia, purulent pneumonia, it is not well. It will not change any code selection based on it. It will be changed based on the this only. With influenza lung abscess, after that, we have to check lumbar abscess is there or influenza is there. If it is not there, we have to go to complicating pregnancy or birth, congenital, neonatal, pneumonitis, aspiration, bacterial. We have to check the baseline. We don't take disseminated global or whatever the parenthesis. It is non-essential modifiers only. It will not change based on if they documented infective. If infective pneumonia, don't code this congenital code. Congenital has to be the from birth onwards. Okay, that is that is it is the main criteria. It is non-essential modifiers brackets NEC NOC. These are the very important conventions in the coding. Okay, ICD-10 coding. Yeah. After that, take precedence. For example, modifiers. The non-essential modifier is in the alphabetic list next to index applied to subterms following a term, except when a non-essential modifier and a sub-entry are mutually exclusive. Mutually, the sub-entry takes precedence. For example, ICD-10 alphabetics under the main term entries. Enteritis acute is a non-essential modifier and chronic is a sub-entry. Okay, we will check in that. Enteritis. Enteritis is enteritis is acute diarrheal hemorrhagic infective disease, non-essential modifier. You have to take the enteritis only. Okay. Here they mention there is a subcategories. Okay, subentries are there. Irritable bowel syndrome, megacolon, bacterial, chronic. If the doctor documented the chronic, we have to take the chronic. Ulcerative or other unspecified. We have to take other unspecified. You have to take whether they documented any functional diarrhea, neonatal diarrhea, psychogenic diarrhea, allergic, dietic, drug induced due to radiation, eosinophilic, toxic, other means the doctor documented chronic enteritis, something. But here there is no document, there is no document, subentry, we have to take this. The doctor documented chronic enteritis, that's it. You have to take unspecified. Non-infective gastroenteritis due to. It is the meaning of it. Answering is an alphabetic distinction applied to subterms following a main term except when a non-essential modifier and a subterm are mutually exclusive. The subentry is takes precedence. For example, in the alphabetical index under the main term entities, the acute is non-essential modifier and a chronic is subentry. Okay, in this case, the non-essential modifier acute does not apply to the subentry chronic. Colons are used in the alphabetical if term, incomplete term, which needs to one or more modifiers following the colon to make it applicable, assignable to given category. If colons, if there is an incomplete term, it will be denoted by term. It will follow the complete. Okay, it is any colon is there. We have to check it is not complete. We have to follow the next listing. Use and none. Section use of term and other unspecified codes, other specified unspecified code as discussed. Include notes. This note applies. I already discussed. No? What is an not elsewhere classified code? What is unspecified code? Same as in previously discussed. Include notes. This notes appears immediately under a 3-character code titled to further define or give examples of the content of the category. Okay, include notes are Sometimes, okay, I will show you. Includes chapter on certain infection characteristics. Course generally characterized communicable, transmissible. It not okay. It is to further explain the in certain infectious and parasitic diseases. Diseases generally recognized as communicable or transferable. Okay, if you I-25 category. Okay, go to I-25 category. Okay, I-25 category includes, excludes, chapter notes, section guidelines. Okay, you have to check excludes section list. You have to check this includes notes. Includes notes further explain the to further define or give examples of the context of the category. Inclusion terms. List of terms included under some codes. These terms are the condition for which the code is to be used. The terms may be synonyms of the code title or in the case of other specific code. The terms are a list of the various conditions assigned to that code. The including terms are not necessarily exhaustive. Additional terms found only in the alphabet index may also be assigned to a code. Exclude notes. It is very important. We will discuss tomorrow. Okay. It is 40, around 40 minutes now. You will stop here. It is very important. Whatever discussed in this class now, it is very important. Here the alphabetical index, we have to go to alphabetical index and code for the full list in the tabular list. Okay. Format and structure, we have to follow the format and structure, use the reporting purposes, placeholder character, seventh character is X is there. We have to report. We don't, we have to go to a fullest form of the subcategories for valid codes. Okay, we have discussed NAC and NYS in the tabular list and alphabetical index punctuation. Whatever bracket says is the synonyms and alternative wording. Parentheses are non-essential modifiers. That will not, the code selection will not change based on the words mentioned in the parentheses. Okay. Brackets is very important in cause and effect relationship codes. Diabetes, hypertension, CKD, CHF, like that. We have whatever, whenever there is a cause and effect relationship, it will be not mentioned in the brackets. Okay. Suppose the patient has a diabetes and CKD. It will give the CKD or something code in the brackets. Okay. To mention it is a cause and effect and manifestation codes. Okay. And use of and we will discuss later. There is a meaning, and meaning is very crucial. And with or and are very critical in the ICD-10 coding. Okay, whenever there is an exclude one, exclude no, don't non-essential modifiers, tabular index. Okay, index for diseases, index for external cause of injury, index for neoplasm, index. There are different guidelines. Neoplasms have different guidelines. Adverse effects poisoning and has a different guidelines. Okay, external cause of injury has a different guideline specific to that. When the patient is having any diabetes and CKD things, there are different guidelines. The patient has any bonds, there are separate guidelines. When the patient is pregnant, there is separate guidelines. Okay, when the patient has any pressure ulcers or something, there is different guidelines. Okay, we have to make sure that for what condition the patient is coming and what that they are doing and what they documented. If they documented any relationship with them, we have to follow the relationship between cause and effect with diabetes or CKD. If they did not documented, we take the precedence from the guideline specific. Okay, you have to follow with non-essential modifiers, neoplasm, adverse effects, and external cause of injury, unspecified, other specified, seventh character, placeholders, and all this is very crucial in coding accurately the ICD-10-CM with regards to diagnosis codes. Okay, whenever there is a term like this, we have to make sure that make a note of it. We have to get alert. There is a guideline change. Neoplasms, adverse effects for anything. Okay. Whenever there is some parenthesis is there. Okay, those are non-essential modifiers. Their code will not change with the words documented mentioned in the parenthesis. Okay, the curly brackets is a different meaning. Parenthesis has a different meaning in the alphabetical index or tabular index. Okay, we have to make sure that these are followed without any mistake to code accurately. Other specified, unspecified, and inclusion notes. Inclusion notes is further explanation only. Inclusion terms are very. The next topic is exclude notes. This is very crucial. It is very crucial. Exclude notes is a very important topic in the ICD-9 guidelines. Okay, we will discuss in the later classes. Okay, thoroughly. If you understand, it is easy. But if you don't understand the exclude note, it will be you will end up in a different difficult situations of selecting. Okay, we will discuss later in the later classes. Yeah, it is around 40 minutes now. I'm stopping the recording. Okay, we will connect later and discuss the exclude notes and any further guidelines in that ICD-10-CM guidelines part. If you have any available coding guidelines PDF, you have to read the each and every word in the space. It will guide you for good coding practices in your career. Don't don't forget. It's very crucial. Okay. Thank you. We will connect in later classes.